This is a long one. Are there different techniques for areolar reduction? What do you do? I've seen that some surgeons perform the surgery by taking away the excess areola in a teardrop shape and then stitching back up, leaving a lollipop type scar to prevent the areolar scar stretching and causing them to regain their preoperative size stroke shape. Is this common practice, or do different surgeons use different methods to prevent the areola regaining their original size? This is, of course, something I would want to avoid when I have this surgery. Wow. Well, I've not seen an areola reduction giving a lollipop scar. A lollipop scar in my practice is a breast lift. So you can do that. You can remove extra skin. I mean, that's why there's more scarring. It's not to prevent, what is it? To prevent the scar stretching. So in my practice, you're absolutely right. There is a risk that the scar can stretch when you do an areola reduction, because you're taking a big circle around the areola and then a small circle, and you take a donut of skin and then you cinch it in. And so there's a risk, because that skin's under tension, that the scar can stretch. So you can, in my practice, the way I do it is I use a permanent suture to reduce that risk. Not everybody uses a permanent suture. Some people use a long-term dissolvable suture. The reason people don't use a permanent suture is because if there's any infection in that suture, or if you can feel the knot, or if the knot extrudes through the skin, that's always going to be there. So that's a problem. So there are, I accept there are risks with using a permanent suture, just like anything. If anyone tells you, tries to tell you that they do a technique that's all good and everyone else is doing it badly, or doing it wrong, you've got to think, hold on a minute, I don't think that's fair. So I think you've got to, full disclosure, there are bad things about using a permanent suture. But for me, the benefits outweigh the risks, because it reduces the risk of stretching, which is a worry you have if you use a permanent dissolvable suture. Although, as I say, dissolvable sutures can they are long-term dissolving sutures, so they take a while to dissolve, and the hope is it will form scar tissue in that time. The thing you're describing, where the lollipop lift, the lollipop scar, is more of a breast lift, which at the same time as a breast lift do form an areolar reduction. So an areolar reduction is an integral part of a breast lift, but it's a bigger operation where you're reshaping the whole breast rather than just the areola, and you're taking a lot more skin away, and that will give that lollipop scar. And it's I would argue, a different operation to an areolar reduction. It's something which you're globally reshaping the breast rather than just making the areola smaller. So I don't think, for me anyway, I think the different ways people do areola reduction is basically whether they use a dissolvable or permanent suture. Those are the two options, really. I think. I'm not sure if there are any other sort of techniques. And then the thing you're describing with the lollipop scar, I would then call a lift, and there are lots of different ways of doing a lift, of course, but I'll call that a lift, which is a bigger operation to reshape the whole breast.